Welcome in, everyone. Ready for another deep dive. Today, we're putting on our detective hats, trading in our magnifying glasses for, well, maybe a goniometer.
You lost me at goniometer.
Okay, okay, fair enough. Let's just say we're about to crack open a real-life case file, a French physical therapy assessment form.
And I'm guessing you want me to make sense of it all.
That's the plan. Now, before anyone starts brushing up on their French, I promise you won't need a phrase book for this one.
So, no. Où est la bibliothèque?
Not today. We're more interested in the big picture. Think of it as a behind-the-scenes look at how physical therapists approach healing, the clues they look for, and how they piece it all together.
It's like deciphering a code, but instead of hidden messages, we're uncovering the secrets of movement and recovery.
Exactly. And like any good mystery, we start with the basics, right? Patient information, name, date, the usual suspects. But there's this little section right at the top that really caught my eye. It's these two checkboxes for cabinet and domicile.
Ah, yes. Those might seem like small details, but they actually tell us a lot about the changing landscape of healthcare.
Like what?
Well, cabinet, meaning the office, that's the traditional setting we usually picture for physical therapy. But domicile, now that's interesting. It means home visits, and to me, that signals a real commitment to patient-centered care.
Making therapy accessible, meeting people where they are, literally. I can see how that would be huge for someone who's struggling with mobility issues or maybe doesn't have easy access to transportation.
Exactly. Imagine an elderly patient recovering from a fall, for example.
Yeah.
The thought of navigating public transportation to get to appointments, that could be a major obstacle to their recovery. But home visits, that removes that barrier completely, allowing for more consistent care and potentially even a faster recovery.
It's amazing how much one little detail can tell you about a bigger approach to care. But let's move on, shall we? Because I'm dying to get to the good stuff. This section titled Pathology for us non-French speakers, and Symptoms Annexes, which means, you guessed it, related symptoms.
This is where the real detective work begins.
Lay it on me.
It's about gathering the evidence, understanding the patient's medical history, what's going on right now, any other conditions that might be playing a role in how they're feeling.
Like a physical therapist's version of a magnifying glass.
Precisely. Examining every single detail to get the full picture.
And I'm sensing it's about more than just ticking boxes, isn't it?
Absolutely. This isn't just a checklist of symptoms. It's about understanding what this particular patient is experiencing. Because two people can have, let's say, back pain, but the reasons behind it, totally different.
So you really have to dig deeper, right?
Exactly. Connect the dots between their lifestyle, their medical history, those current symptoms, to figure out what's at the root of the problem.
Fascinating. Okay, so we've got our patient story. We're starting to understand the why behind their visit. What happens next?
Well, that's where things get really interesting. Because now we dive into the body itself. The form breaks it down by region, the trunk, upper limbs, lower limbs. It's like mapping out the terrain.
And I bet that map holds some pretty important clues itself. But we're going to have to save that for next time because we're just about out of time for today's deep dive. You know, it's funny. I always picture physical therapy focusing on the problem areas. But this form, it's like they're looking at the entire body as one big interconnected system, you know?
It makes sense, right? To understand how everything works together, how one little thing can throw the whole system off.
And speaking of systems, this next part is where things get really interesting for me. The form breaks the body down into specific regions: the trunk, members superiors, that's the upper limbs, and members inferiors, which are the lower limbs, like they're charting a course, right?
Exactly. It's a really systematic approach, not just looking at the body as a whole, but zeroing in on specific areas.
Okay, so we're getting granular here. Now what?
Well, within each region, there's a whole section dedicated to range of motion, how far a joint can move in different directions. They've even got these little diagrams, standard anatomical illustrations, to make it all official looking.
Diagrams, you say? Sounds serious. But why so much emphasis on range of motion?
It's about understanding limitations. Think of it like this. Range of motion is like the currency of movement, dictates how freely you can move, bend, interact with the world around you.
Okay, I'm with you.
So by measuring it precisely, physical therapists can spot even the smallest restrictions, the ones that might be contributing to pain or making it hard to do everyday things.
Those sneaky little things you might not even realize are holding you back.
Precisely. And the thing is, those minor restrictions, if they're not addressed, they can snowball into bigger issues down the line.
Like a domino effect?
Exactly. One restricted movement leads to another, and before you know it, you're struggling to do simple tasks.
So catching it early is key.
Absolutely. And that's where physical therapy comes in. By identifying those restrictions early on, they can intervene with targeted exercises, manual therapies, all sorts of techniques to help restore proper movement and prevent those complications from developing in the first place.
Now that's what I call preventative care. Okay, so we've talked about range of motion, but there's this other section that's really caught my eye. It lists a whole bunch of conditions. Arthritis, fractures, edema, nerve injuries, you name it. It's like they've crammed an entire medical textbook into this one form.
It just goes to show you the wide range of issues that physical therapy can address. And each one, of course, requires a tailored approach.
Right, because a broken bone needs a different game plan than, say, chronic arthritis pain.
Exactly. That's why this assessment is so important. It gives the therapist all the information they need to develop a treatment plan that's specifically designed for that individual and their unique needs.
So it's not just about treating the symptom, but understanding the whole picture, all the factors that might be at play.
Exactly. And that's what makes this next part so interesting. Because we're going to move beyond just the physical. We're going to dive into the world of troubles, neuropsychological issues, ready to go a little deeper.
Always up for a challenge. But first, we're going to take a quick break. We'll be right back with more of this fascinating deep dive after these messages. Okay, so before the break, we are about to venture into uncharted territory. Troubles neuropsychologiques. Not exactly the first thing that comes to mind when I think about physical therapy.
Right. You think muscles, joints, bones, but the mind. That's a whole other ball game.
So walk me through it. What kind of neuropsychological factors would a physical therapist be looking at?
Well, think about it this way. Our mental and emotional states, they have a huge impact on our physical well-being, right?
Okay, yeah. Stress can make you tense up. Anxiety can manifest as like stomach problems. I've heard of that.
Exactly. So a physical therapist might be looking at things like stress levels, anxiety, even past traumas. All those things can manifest as physical pain, limitations, you name it.
Wow, so it really is about treating the whole person, isn't it?
Absolutely. And this form, it really highlights that holistic approach.
Yeah.
It's not just about fixing the physical problem. It's about understanding how all the pieces fit together, the mind, the body, the whole shebang.
It's kind of like detective work, right? You have to look for clues everywhere. Speaking of clues, there's another section here that caught my eye. It's titled Troubles Cardiorespiratoires. Cardiorespiratory issues. Now, I'm really lost. What does breathing have to do with physical therapy?
More than you might think. We
Mhm.
often forget about those essential systems, our heart, our lungs. But they're the engines that keep us moving, literally. They provide the oxygen and energy that our muscles need to function properly.
Right. I guess you can't exactly go for a run if you're out of breath after 2 steps.
Exactly. So physical therapists pay close attention to those systems, especially when they're working with patients recovering from surgery, illness, anything like that.
So it's about making sure the body is working as efficiently as possible, that those systems are on board with the whole recovery plan.
Precisely. It's about finding that sweet spot, challenging the body enough to promote healing and strength, but not pushing too far too fast. It's all about balance.
Makes sense. And speaking of plans, I know we're getting close to the end here. What about the treatment section? What kind of tools do physical therapists have in their arsenal?
Well, let's just say they've got options. The form lists a whole range of techniques from massage and electrotherapy to mobilization and even things like home exercises.
Wow, it's like a whole menu of treatment options. How do they decide which ones to use? It seems like it could get overwhelming.
Well, that's where all that detailed assessment we talked about comes into play. The therapist uses all that information, the patient's history, symptoms, lifestyle, to create a plan that's specifically tailored to their needs.
So it's not one size fits all. It's about finding the right combination of techniques for each individual patient.
Exactly. It's about creating a roadmap to recovery, and the patient and the therapist, they work together every step of the way. It's a true partnership.
Wow. You know, when we started this deep dive, I have to admit, I thought physical therapy was pretty straightforward, but this form has totally changed my perspective.
Right. It's so much more complex and nuanced than people realize.
It's like a whole hitting world of healing, and this form, it's like the key that unlocks it all. It makes you wonder, what if we all approached our health with this level of detail, with this kind of personalized care? It's pretty amazing food for thought. Well, that about wraps up our deep dive into the world of French physical therapy assessment forms. Big thanks to my guest for breaking it all down for us. And to all of you listening, stay curious, and we'll catch you next time on The Deep Dive.